One of the major success stories of the latter half of the 20th century and now the beginning of the 21st is the survival from cancer.
We're incredibly successful at treating cancer now. So really what we have to think of as physicians is how to help you on the backside of that so that you know what to do and how to continue your life once you've gotten through this really tough episode.
Of all the subspecialties, oncology was a real pioneer in a team approach in trying to address the various needs of the patient, curing the cancer, preventing its recurrence, but also looking at other aspects of well-being for the patients through social work, counseling.
The first thing they think about is their family. They want to be with family. And for some of them, that means they really wanted to have a family.
And the number one question these women and men want to know is, how will this impact my fertility?
I always tell patients during the fertility preservation consult, this is a moment where you can pause, set all that aside. This is going to be an island of time where we're not going to talk about side effects of chemo or surgery. We're going to talk about your future. And I want you to focus on a cure well beyond the diagnosis and the chemo that you're going to look to in 5 years.
Here are your options. Let me help you make some decisions in this really challenging time so that you can have some hope that that family is going to still be there for you when you get through this diagnosis.
And studies have shown that men and women who can focus on this future actually do better from their cancer treatments. I'm going to do tests. I'm going to look at where she is in her menstrual cycle, and I'm going to send a note back to every person involved in her team. Can we get this done before she needs the chemo? Can we do it between her surgery and the chemo?
And I've never had an oncologist push back and say, no, this is bad. Rising estrogen levels are not good for this patient. I've always had the oncologist say, great plan, let's go.
Getting into a reproductive endocrinologist as soon as possible is key because there are some things we need to do on our side to be ready for you and to help you in this process.
I like to frame it as the potential for your future after a cure, where you're talking about when you're going to use your frozen eggs or when you're going to try and get pregnant. That should be the focus as part of our fertility discussion for the oncology patient.
When they come back with those children, I can honestly say nothing in my medical career has ever been more rewarding.
Because I think they really appreciate where they've been and where they're going and the joy that family can bring to them.
I mean, they've grabbed the brass ring twice, free of disease with their kid. It's the best moment. That's why we do this.